Hello, my name is Dr. Genevieve Hale. I am a clinical pharmacist that works at Southeastern University as an assistant professor and MMR Healthcare. My specialty is in cardiology, and so today I will be showing you how to monitor your blood pressure at home and ensure that you get the most accurate reading possible. So the first thing is the actual blood pressure machine itself. So I'm going to be using today an automated blood pressure machine, which looks like this, and you can find tons of them on the market that look similar. You don't have to buy the most expensive one out there. You can find them simply in your local pharmacy, grocery store, or even online now on places like Amazon. You just need to ensure that the monitor tells you your blood pressure and your heart rate. And also, when you are buying the blood pressure machine, it's important that you consider the cuff size or sizes that you need to buy. The one I have here is just a regular sized cuff. So anybody who's normal weight, you should be buying the same thing. If you're underweight, they do sometimes have smaller cuffs that you can purchase, or if you're a larger individual, they also have larger size cuffs like I have here, just to kind of compare. See, it's a little slightly bigger. It's important you buy the right cuff, because if you buy the wrong size cuff, it can either show a falsely low or a falsely high blood pressure reading. So assuming we have all of that straight away, the next thing is figuring out where to actually take your blood pressure. So you need to find a place at home where you can sit comfortably, like I am right now. I'm just in a regular chair that has arms on the chair, which will become important in a moment. It's important before you start taking your blood pressure that you ensure that you haven't exercised, drank caffeinated beverages such as coffee, tea, energy drinks, anything, a soda, anything that has caffeine in it, or smoked tobacco products or taken in tobacco products within the last 30 minutes. If you have, then please wait, because again, your blood pressure reading might be falsely high. And then the last thing is, when you do find a place to relax and sit, make sure that you sit for at least 5 minutes. This will just help your body reset, be relaxed, and ready to go for when you actually take your blood pressure reading. So assuming you've done all that, let's go ahead and put the cuff on. So the way that you would want to put this on is pretty straightforward. So you're going to put your arm through the cuff, and you want to make sure that you wrap it around kind of snugly. So not too tight, but tight enough that it can't really move or fall off. You also want to ensure that the wire or cord here is by the middle of your arm, as close to that as you possibly can, and that your antecubital, or the opposite side of your elbow, that the cuff is like about 1/2 inch or an inch above that, in order to get the most proper reading. If you take medications at home for blood pressure, it's the most important thing is that you're taking your blood pressure around the same time every day, although it is recommended to take your blood pressure medications before you actually take your blood pressure, especially if you take these medications in the morning. The most important thing, that if you take nothing else away from what I say today, is if you are taking medications for blood pressure, please make sure that you really are taking them every day the right way. And if you have any questions about that, please don't hesitate to ask your local pharmacist, your physician, nurses, whoever it is that's your healthcare provider, so that we can make sure that you understand the right way to take your medications, and you really do have to take them the right way the same time every day, because if you don't take those, your blood pressure won't be stable. And unfortunately, hypertension or high blood pressure is a disease where you can't actually feel your blood pressure going up or down. I know you can feel nervousness and anger and all of that, and you are saying your blood pressure goes up, but in reality, day to day, you cannot feel your blood pressure. So the only true way that we can tell if your blood pressure is where it should be is by monitoring it like we're doing today. So with all that said, I'm going to go ahead and hit start on the blood pressure machine. Once I hit start, no more talking. So let's see what we get. Okay, so I got my reading. As you can see, that took less than a minute. So sorry that it's going to be backwards, but my reading is 114 over 76. So the top number is what's called your systolic blood pressure. Bottom number is your diastolic blood pressure. Goal blood pressure for most people is less than 130 over 80. If that is not your goal, you and your physician maybe will decide on something different, but for the majority of people, that's the goal. And then heart rate, my pulse is 77, or that's my heart rate. The usual heart rate normal range is between 60 and 100. Again, some people, you might have a lower heart rate than that on average, which if your physician is okay with that, that's okay. So that's how you read the actual results of your blood pressure machine. It's really important too, when you do take your blood pressure, that you either have a machine that remembers it for you and you bring this in every time you go see your primary care provider or your cardiologist, pharmacist, or just simply write it down on a piece of paper and bring that in to make sure that the blood pressure readings we're seeing at home are similar to those that we see in clinic. It's also really important to tell us if you are taking blood pressure medications that they're actually doing their job correctly. So real quick high points of everything I've said today is make sure when you get a blood pressure cuff and monitor that you get the right size cuff. You can definitely call or ask a pharmacist, physician, nurse to help you if you need help figuring that out. When you actually take your blood pressure monitoring, make sure you're sitting in a comfortable spot at your home, that your arm can rest on something. So like mine here is on the arm of the chair, kind of in line with my chest here. When you put the cuff on, make sure it's snugly on with the cord in the middle of your arm here like this. A little, about an inch or a half of inch above your elbow, that you haven't consumed any tobacco or caffeine products within the last 30 minutes or exercise within the last 30 minutes, and that you're relaxing for 5 minutes before you take your actual blood pressure. And remember to record it. And that's it. Thank you so much for your time and attention today, and I look forward to talking to you or seeing you in person. Bye-bye.